Ladies and gentlemen, let's go over your respiratory system. Respiratory system uh, involves gas exchange. Everything that supports gas exchange in the lungs and respiratory tract and upper respiratory tract all the way to your nose. Okay, so today we're going to go over the structures mainly. You'll need some colors because we want to color code this. So if you want to grab colors, you can. You need red, blue, yellow. I'll be doing orange and definitely purple. Okay, so if you don't have yellow and orange, that's okay. You want the red, blue, and purple because of blood, oxygenated, deoxygenated, mixed. Okay, maybe that's enough for you. No problem. Okay, so this is the overview real quick of the respiratory system. You got the nasal cavities, everything starting with the nasal cavity. Remember how there's all these like adenoids and tonsils here, those lymph nodules that allow for immune system to get activated, but also lots of passageways so that air doesn't just flow. Here, let me put a light there. So the air doesn't just flow one way. It actually kind of keeps the airflow mixed so that it can warm and moisten the air before it gets to your lungs. You need warm and moist air. I just try to see how many times I can say moist in one day. Okay. So from the nasal cavity is the nasopharynx, oropharynx, and laryngopharynx, and so we call that all the pharynx, all of that. So it's a throat. Remember fairy dust? That's that phlegm you kind of cough up. So yeah, pharynx. The nasopharynx comes from the septum and is that upper part of the throat, and I'd say maybe it ends at ends at the oropharynx, but it ends at the bottom of that uvula, which we'll show in a second here. I mean, if you want it, you can color code it a little bit. That's orange. Okay, and the oropharynx is in the back of the throat where those tonsils are, and then the laryngopharynx takes over, kind of where that I've read. Where that epiglottis starts covering up the larynx there, back there, okay? And then the laryngopharynx starts at where that epiglottis would like start, and then it goes to the larynx. So the larynx is down here. Let's color the larynx yellow. Okay, so starting with that, because I feel like that one's easier to identify. La 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 larynx. Like that's where your voice box is. All right, so that kind of, that beginning of the trachea, or the, opening to the trachea, larynx. So we want to label that larynx. Okay, and then the trachea is below that. Okay. So I think we decided to color the pharynx blue. Okay. Right here. So we have the nasopharynx on the way to the nasal cavity. Only air should go there. Okay? If you get anything else, it hurts. It's not supposed to be there. Food, water. No, let's not do that. Oropharynx, food and water, and then laryngopharynx on the way to the larynx and the esophagus. So that's going to be food and water. And then you're going to have the epiglottis is going to flap down there and kind of separate the laryngopharynx after it flaps down. It covers the larynx so that the esophagus will then just receive the food and water. And then the air, hopefully, will just go in the larynx. I mean, you can kind of open up your esophagus if you're trying to like create a belch, when you don't already have a burp coming. So I don't know, maybe some grade schoolers there have taught you how to do that, because that's when I learned. It's very important thing to learn. Okay, the blow up here of the nasal cavity and then the nasopharynx here, just showing, that uvula, it's an extension of the soft palate, which is an extension of the hard palate. Okay. And the uvula, even though it dangles down, it looks useless in the back of your throat, except for choking yourself if you like poke at it. It actually flaps up. It's supposed to close or help. It doesn't close all the way, but it helps block off your nasal cavities, okay? So that you don't get the food up there. So there's the nasopharynx, and that's the top part of the pharynx, okay? So, just you can kind of see here, they showed the cranial nerves, that nerve tract 1, that's where those sensory neurons are for smell. Okay, and so another reason why it needs to be moist up here is you need to dissolve smells in there, so that you can the nerves can encounter the molecules, and the proteins can change conformation and alert the brain that you're smelling, you have a gas leak maybe. Okay, hopefully your brain will alert you that. Mine won't. I sometimes, I don't know what it is, but I'm just like naturally nose blind. It's an advantage when you're a high school anatomy teacher. All right, just saying. All right, so uvula right there. Soft palate, yeah, you might want to label that. Good job. Oh, yeah, maybe hard palate. Sure. Just like we talked about. So I kind of want you to focus on that. Down farther from the trachea. So trachea is kind of like the the trunk of the tree, and then the branches are the bronchi, hence the term bronchi. We have primary bronchi that are the first ones that branch off the trachea. So that's here and here. It goes from to the left and to the right side. Okay, the air goes to the trachea, and the trachea has a cartilage that vacuum hose rings, so it can stay open at all times, or it's supposed to. And remember, those rings are C-shaped. They are not all the way circular. Okay, so here's a cross section of trachea, and here's the cartilage that you can feel, and it's that vacuum hose. On this back side here, we actually have esophagus. So I'm going to draw it in here just as a flat oval, okay, to remind you that on that backside, the reason why the tracheal rings, tracheal cartilage are C-shaped, because you have that esophagus, and maybe you're eating food and you need room for the esophagus to be able to expand when you're swallowing all of that food. Okay, so that's there. Also, cross section of the trachea is going to show my favorite type of cell, pseudostratified ciliated columnar epithelial tissue. All right, it's a type of connective tissue, and it's not actually stratified. Remember, it looks like it's stratified, but most of the cells, they go all the way through. They're just kind of bigger at the top or the bottom, or thicker at the top and some of them are thicker in the bottom. Okay, and you might be like, well, why the heck? Okay, well, you know how stratified is nice, because if the upper cells kind of get damaged, then the cells below will still be there to protect. Well, maybe same thing here. If these upper cells get damaged, these lower cells are already kind of almost partially filled in, and it protects the lining of your trachea. The cilia, so that's good that it's ciliated. They're always going to try to wave and direct mucus up your trachea, all right, into your mouth, so you can cough stuff up, maybe even swallow it again. Sure, swallow it down your esophagus. So, get garbage out of your lungs. So if there's junk in the air, hopefully it sticks to the mucus. The goblet cells probably creating mucus. There's actually also some, what do you call these, submucosa cells that secrete mucus here too. They're glandular cells, but definitely goblet cells are creating mucus here. To keep things moist, again, things need to be a little bit wet so that they're not dry. These are mucous membranes that are moist, and also you need the simple squamous cells in your alveoli to be protected, but also you need something for the oxygen to dissolve in. Okay, so it's got to be a little moist for this to occur. Okay. Oh, I said pseudostratified ciliated columnar epithelial tissue. I didn't say connective tissue. Epithelial tissue, because it's a covering. So the cilia sweep stuff away from the lungs. Okay. And remember, smokers kind of disable that. That doesn't work so well, so they can't cough things up. So they kind of have to actually try to throw things up their trachea. Down here, by the way, is cartilage. So that's where the cartilage rings are. It has some nice connective tissue here to connect it to the cartilage. But here and down could be cartilage, and it's pretty thick, stiff cartilage when it's on the trachea, right? Well, going to the bronchi, here's the primary bronchi, main primary bronchi. They've got pseudostratified ciliated columnar epithelial tissue. Same idea. Cilia is going to try to get stuff out of your lungs. But as you go to the tertiary, the secondary and tertiary, especially the tertiary, that's so primary branch, secondary branch, and then the tertiary are these little guys. They actually don't have the pseudostratified. They still are ciliated, but they just have more columnar epithelial tissue. Okay, so I don't know where you want to put that. Segmented tertiary bronch. Okay, so they're saying that these are the tertiary. Okay. And you'll notice that the left side has like 2 main bunches, and then the right side has 1, 2, 3 main bunches to go to the 3 different lobes on the right and the 2 on the left. Okay, because we'll leave a little bit of room for the heart, I guess. And that's all we're going to talk about on this side. So let's turn to the next page. We're going to have a detailed upper respiratory tract. Okay. Nasal septum, that's the nasal cavity. This is just showing the septum in the middle. It's not showing in the adenoids. Okay. Yeah, it's big. It goes all the way there, in there and back there. And so if your sinuses aren't draining well, you can have a lot of junk in here. All right. And maybe you have swelling, and it's not allowing things to drain real well. Also, you have sinuses in your bones. It's true. Sinus cavities. And you have ways to drain them, but they're not on this. We don't really study that. Okay, same idea, except for I like this picture because it shows you where the eustachian tubes sort of drain into that oropharynx area, nasopharynx area, and then to the oropharynx. So let's say label these nasopharynx. I don't know if you can see that. And there is the oropharynx here. Oh, that wasn't the line. Here, we got to make our own lines. Got lots of lines, but meh. All right, so nasopharynx, just air, no water or food. All right, oropharynx is where you're gonna drink and eat, and breathe. So you're gonna get air, water, and food, and then we're gonna talk about here is the laryngopharynx that we talked about. Okay, and then these are all your pharynx. All right, which is your throat. And the fairy dust. That's the gunk that you're gonna cough up. All right, so we can color all this blue. And yeah, you have tonsils different places, you know. Adenoids and tonsils are lymph nodules. And then I believe they show you your tonsils. Maybe they're trying to show them here. It says lingual tonsils here, but there's some in the back also. So you have some tonsils in several places for your body, in your throat, to deal with germs, hopefully. Here's your uvula again. Yes, we all have that. And when it's not flapping to cover the nasal passageway to the nasal cavity, then it actually kind of forms a boundary. We like to call that the boundary between the nasal pharynx and the oral pharynx, approximately. And here's the hard palate and the soft palate where the uvula kind of hangs off of it. Okay, so here's uvula. Ooh, right there. Epiglottis, I like to color red. And when you swallow, the tongue helps, and on these neck muscles actually help. And it closes down that epiglottis, and it flaps. And the epiglottis has a little bit of cartilage itself to help flap over and cover that larynx so that you can swallow food and not have it go into your lungs, okay? Hopefully it goes into your esophagus, which is right there, okay? So red was your epiglottis, which is not labeled here, so we kind of have to label it. And then we colored your larynx yellow, right? Okay. And that's where your voice box is. Your Adam's apple, whatever you want to say, that has some cartilage in there and a whole bunch of muscles in there as well as on the outside to help you modulate that air, that vibrations of your vocal cords. All right. So you have the hyoid bone floating on here. I don't think it's labeled here, but it should be in front. And then you have suprahyoid and infrahyoid muscles that'll help you sing higher or lower. And then a lot of muscles in here as well to help change the diameter of that, I guess, because that'll change the frequency and of the vibrations. Here we go. Larynx. La 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 larynx. So you remember that's where your voice box is. All right, good job. So then, oh gosh, I colored this part. Really, it's not. really, this is your trachea. Here we go. Okay, trachea. Wow, I'm on a roll. It's hard to talk and write at the same time. What do you know? Okay. That's all we're doing for the pharynx and the larynx, and then we're going to go down here. We talked about the primary, secondary, and tertiary bronchi and how they're all ciliated, whether they're pseudostratified or it's columnar ciliated epithelial tissue. But when you get down to the alveoli at the end of the tertiary bronchi, or bronchus, which would be singular, you're gonna have eventually it's gonna get to these. They always look like grapes to me on the outside, but if you're thinking about the inside of them, they're honeycombed. So there's little pockets of simple squamous tissue, and that's what forms the alveoli, the air sacs. So let's label those, and that's important to get oxygen all the way down there in the air, to get air down there, and so we can get rid of oxygen and or get rid of CO2 and get oxygen in, okay? Those are your air sacs. Simple squamous. Right? You want it thin enough to allow for air exchange, okay? So what's happening on the inside, which is your lungs, you get you get some unoxygenated blood. So let's lose blue. Gotta use blue, right? Now, it's leaving the heart. The blood has left the heart from the right ventral through the pulmonary artery to pulmonary arterioles, which are baby arteries. So it's gotten the branch is smaller and smaller and smaller. Still unoxygenated, but yeah, it's an artery. Actually, arteriole, baby artery. And then it's going to become capillaries, right? So remember, art is from the heart. So that's why we call these arterioles. Because they need to withstand that pressure because they're right after the heart. And then gas exchange is going to happen in these alveoli. Hopefully pick up oxygen and give off CO2. So I'm going to make this purple. This is kind of supposed to be more purpley because this is going to mix. You're going to have some blood that's now oxygenated and some that's still unoxygenated. Okay, so hopefully by the time it leaves, it's been oxygenated. And these are tiny, tiny, tiny air sacs. Things can clog them. Grains of dirt can clog them. So that's why it's important to have that mucus that protects these air sacs and gets all the crud to stick to the mucus, and then you have to have that cilia to help you cough up that mucus, all right? So maybe in asthmatic people, it's not working so well for various reasons. Lots of times you get inflammation, maybe due to allergies and stuff like that, and you don't get as much airflow. Really, it's harder to get the air out. That's where you get the wheezing. I have asthma. So blood going back to the heart through the vein, pulmonary vein, and venules and extra baby veins, and then they're going to join other baby veins and become veins, just regular pulmonary veins, and dump into the left atrium of the heart, and then the left ventricle, and then they're going to go to the rest of the body. Okay, so that's how that one goes. So these are pulmonary capillaries in purple here. Just like the capillaries in your body, they're simple squamous tissue as well. So you have two layers of simple squamous tissue you have to get past. One is the lungs themselves of the alveoli, and the other is in the lining of those capillaries. Okay, so here's a blow up of, I guess, the simple squamous tissue of the lungs and the simple squamous tissue of the capillaries. Okay, so we're going to label these purple, or color them purple. Just remind you that these are the capillary walls, and then I guess that's the lungs here. So CO2 in the unoxygenated blood. Oh, this is supposed to be a red blood cell, by the way. By the way, CO2 doesn't usually bond to the red blood cell. It's usually dissolved between the red blood cells in the plasma. Okay, and that's good because CO2 doesn't have quite the affinity for the hemoglobin that oxygen does. Because yeah, you want your heme group to let go of the CO2 easier than picking up oxygen, because when it gets the chance, you want it to right away pick up oxygen from the air and carry it away in the hemoglobin that's all packed in those red blood cells. Okay, so but we just did that in the picture to kind of just depict the fact that CO2 goes out and O2 goes in. Okay, just so you didn't get confused that your red blood cells don't really pick up very much CO2. It's usually dissolved in the bloodstream, which actually makes it a little acidic, and then your body has to kind of deal with it, and actually makes makes a makes it H3O. So you make like carbonic acid, I think, too, in your bloodstream, and then you hopefully get rid of the CO2, and it makes you less acidic. Actually, yeah. So breathing out actually makes your bloodstream more basic, more neutral. All right, it takes the acid out. So yeah, this is air inside the alveoli. And that's all I can think to write for that. If you have questions, yeah, please feel free to put them in the comments. Thanks for traveling through the cardiovascular, respiratory, and lymph system. And yeah, good job. You did it. We'll talk later. Hope you're having a good day. And until then, we'll see you soon.